And we are going to work on creating folds and faults. So you got to have strata, flat layers to start with. My name is Debra Hardy. I'm 60 years old and I live in Crum, Texas. So the oldest has to be on the bottom. I'm a 30-year teacher and I teach the fun stuff, physics, geoscience, and astronomy. You're going to have to draw some pictures. When I was middle teens, missed a step in the stairway at the house and took a header down the stairs head first. It's just kind of one of those background aches that you just kind of go, okay, I messed up. It's just that annoying background that after a while it's there, but you're so used to it, you're just like, this is how it's going to be. I had taken my dog out for a walk and she kind of changed directions and pulled more than I expected and just pulled me off my feet and dropped me on one knee. I had missed a day or two of work because getting out of bed just didn't happen. Getting up and down out of my chair to go to them for questions was becoming more of an issue.
Are you doing everything that you want to do? I'm Michael Catino. I'm an orthopedic spine surgeon at Texas Health Denton. So Debra Hardy, she was really struggling with increasing back pain going down into the hips, down into the buttocks and the back of her thighs. And she got to the point where it didn't really matter what she was doing. She just really was having a hard time with her activities of daily living.
When Dr. Catino looked at it, he said, this is what our problem is, that the vertebrae had come forward and that it had all of the nerves that go between L4 and 5 in a rather serious bind.
And because of that subluxation and the deformity, she had a substantial amount of nerve compression and malalignment of the spine. The nerve was getting compressed badly, and that's why she was getting that pinched nerve pain. Physical therapy was an option, some home exercises we discussed, as well as injections, and some of that treatment she had before, but in the end, she was just really seeking a surgical solution.
But it was like, this is gonna fix it? Dr. Catino said, yep, this will fix it. And I'm like, all right, let's fix it.
So what we decided to do surgically is to try to realign the spine with some different implants. The surgery went beautifully. We had a tremendous amount of success getting the pressure off the nerve, which made all her leg pain go away. By realigning the spine, her back pain resolved.
It was the first time in probably a year that I could walk and I wasn't making creaky noises. And it was just so improved over what I was accustomed to. It was amazing. I could get up and down out of my chair. I could get stuff for the kids. I could get my lab set up and running.
She's just elated. She doesn't have the pain in the back. She doesn't have the pain in the legs. She can do the things that she wants to do at home.
Texas Health Denton was amazing. I like the private room. When I don't feel well, I'm very cranky. But the nurses were, they were on the ball. You buzz, and they were there before you got done picking your finger off the buzz. Very much concerned. They were always, all right, do you feel, is there something I can do? Does something new hurt? What can I do for you to make this better? And it was amazing. It took a lot of the stress off of it. Whatever you needed to make you comfortable and make sure that you were well on your way to recovery.
When you can make a difference in that person's life, that's why you do what you do.
It got me back into what I do. I teach lab sciences, so being mobile is a requirement. And it was back to the point I could do the stuff for the kids I needed to do.